Okay, so we're going to go ahead and start a study by clicking on the white plus sign. Most important thing is to pick the right modality. So the first item on the top of the list gives you the modality list. It defaults to digital radiography, which is your standard flat panel detector. But the user needs to go ahead and pull down that list and show the dental sensor, which is the DentiSlate for intraoral exams. And highlight that. Once we've done that, then the rest of the patient information is pretty straightforward. And once they have at least that much information, they can go ahead and start the study by clicking on the Start button. In this case, my sensor is not plugged in, so we're not able to take an image, but we can see the new anatomies that are on the side here. Previously, there was only up to the teeth on the anatomy list. You'll notice it also defaults immediately to the head anatomy picker. So this is for intraoral dental, so the other body parts are not included, and the icon down here that splits between distal extremities and axial skeletons has been disabled. So the user would then go ahead and select anatomy first. In this case, we'll select the maxillary incisors and highlight it. If the user just wants to do a simple DV, or dorsal ventral projection, they would use the same arrow configurations that we always do for the skull and select the button that points down in the DV direction. And then the system would go to a ready state and they can acquire the image. If the user wanted to select something other than a DV or one of these projections that is simplified in the arrows here, they could go ahead and pick some of the specialty views that are noted here on the pop-out list. These are more specific images and are radiologically more accurate for dental imaging of horse head, and especially the intraoral exam. So the user would start with doing a left 22-degree dorsal ventral oblique view by selecting it, and that is indicated here. Once they expose the patient, then this would be the exam image that they would see. If they're done with that and they would like to switch to the other detector, the flat panel detector, they could simply go ahead and click on the cloverleaf. And you'll notice that currently the tooth icon is the one that is actually highlighted. If they want to switch to the other detector, they may go ahead and hit the lateral view of the foot radiograph icon here. They will notice that another exam has been set up and it says test at the top here, meaning it's the same patient has been created but using for the digital radiography modality. If they want to go and take an extraoral headshot, they would select the icon down here to leave the distal extremity pickers, and they will have their head icon and select that. And now they would see all those same structures as before, except this time when they do select the lateral in this view, they would actually be, well, let's pick an anatomy first, and then a lateral. They would actually be activating the flat panel detector to take this exam in this shot. And once again, if they want to switch back to the other detector, the intraoral sensor, they would hit the clover and go back to the tooth icon where we were before. When they're done taking all their images, of course, they can hit the clover and go to home. And now, when they go into the study screen, you'll see that there are two exams that are started with a patient name test, one of which is the normal DX modality for the flat panel 10x12 detector, and the other one is for the intraoral dental sensor as the DN modality.